Awesome. Okay, so I think we're good to get started. And then if more people join, that's fine. If I can get in. All right, so I'll introduce myself first. I'm Jessica Kirschbaumer. I am Vice President and Communications Chair of the Alberta Horse Trials Association. And these AHTA educational sessions, this is the third one we've done sort of this winter, spring. And we want to thank everybody for coming. We've had excellent turnouts and interest for all of them. So that's really, really exciting. We're glad that you're liking what we're doing, and we appreciate all our great speakers that have talked so far. And we have Dr. Sarah Pedersen here that is going to do the Care of the Aging Event Horse session with us today. So I'll turn it over to you, Sarah.
Thank you.
You can introduce yourself. I'll stop sharing my screen and then you can get into your presentation. And then for anybody who has questions, if you just type them in the chat as we go, and then we'll go through them all at the end. That would be awesome. All right, so I'll stop sharing and you can share your screen.
Okay,
Sarah, and then you can
go with that one. And then let's do that. Does that look like a presentation?
That looks perfect.
Super.
Awesome. Take it away.
All right. Good evening, everybody. Thank you for having me. This was a really interesting topic, actually, because I don't think often generally we give as much attention as we should to aging or senior horses. I think eventing is a really interesting spot because we do tend to have horses in eventing longer than a lot of other spots. So for those of you that don't know me, my name is Dr. Sarah Pedersen. Hopefully you'll see me at events this summer competing. I have been with my own practice, I guess, for the last 5 years, looking mostly at performance medicine and performance maintenance. And I also event, so I'll see you around there. With that, I'm old school, sorry, I have to flip my paper. Let's have a look at, first question is, what is considered old for a horse? Oh gosh, that one didn't come up very well. Sorry, everybody, it's just a Google image. It's generally accepted that about 18 to 20 is considered geriatric in horses. And I think we have a lot of horses still competing at that age. And it's pretty reasonable then that a 16-year-old horse can be considered a senior. And there's a lot of 16 to 18-year-old horses still eventing, but they might just need a little more care and attention. So signs of aging. This is a huge list, and I think most of us sort of implicitly know these things. The appearance of gray hairs on the face, decreased elasticity of the skin, decreased muscular strength and definition, loss of elasticity in tendons and ligaments. That's an important one to remember and keep in mind for later. Joint stiffness, also important, we'll come back to that. Reduced digestive efficiency and increased risk of colic. Again, we'll come back to that. Gum and dental disease, that's a huge topic. Reduced exercise tolerance and difficulty conditioning. That's a really big one for eventing as well, especially if we're having horses that are at the higher levels. If we're struggling to condition them, we certainly need to look at stepping them down or finding a different job. Reduced mental alertness and increased napping. Obviously, that's pretty important if we're talking about a horse that might be going cross country. Osteoporosis is certainly one that we know. Trouble maintaining weight, reduced tolerance for extreme heat or cold. Anybody that was up at Prentice Creek last year, it was over 40 degrees for a lot of the day. So, you know, we can look at some hot days. Slowing down, they're just less interested in movement in general. Reduced resistance to infections and parasites. Really important if we're thinking about bringing these horses into a population. You know, we have 100 horses on site, just another one to keep in mind. And this is a really interesting one that I think we need to we'll chat about later, but the development of vaccine reactions and allergies. So when I was asked to do this talk, I had a look to see what had been done out there. It's recommended that senior horses, it's recommended that all horses have regular wins, but especially senior horses, because we want to make sure that we catch any problems before they're starting. So a little bit like a pre-purchase exam, but done on a regular basis with your veterinarian. It's a really important baseline. The way that I chat with my clients about it is kind of that the best defense is a strong offense. So we want to try and keep on top of problems before they start. I pulled this paper. It's a really recent paper from 2022 that is done by Sue Dyson in the UK. And they were looking at gait abnormalities and ridden horse behavior. So when it says in a convenience sample, that means people volunteered their own horses. And it's a good paper. It's a long read and it's quite statistically involved. But you can see at the bottom there, 62.2% of horses were lame when they were ridden. Not great odds. And that's regular horses. That's not senior horses. So it's pretty reasonable to assume that there's an increased level of lameness in our senior horses. So I really brought that up just to get home the point that we really need to take care of our senior horses and have them thoroughly and regularly assessed. This is the ridden horse pain ethogram that they used in this study. And I think Jessica and I were talking before. I can provide this paper for people to read afterwards with this information in it. But these are some things that have been sort of recognized by experts as signs of pain or problems in the ridden horse. So this, you can read, it's a big long list there, but some things that we may or may not see with our horses: the head in front of the vertical or the head behind the vertical, head tilting repeatedly, repeated changes of head position, tail swishing, tongue extras protruding or hanging out. And I mean, most of us can read that list and say, oh gosh, well, my horse is one of those or whatever. But I think the point is that we want to be mindful of changes. So if you have a horse that's been very, very happy in his regular work and all of a sudden we start getting head tossing or head changing of position, could be an indication that we have pain. So that's why that's there. And like I say, Jessica and I will make sure that you have access to that document afterwards. Oh, now it's angry. Common diseases seen in older horses. So dental problems, we're going to talk a lot about that. We're going to talk a lot about endocrine issues. I think most people expect osteoarthritis to be on the list. Colic, we need to be a little more careful in our older horses because of the dental issues, because of nutrition issues. And they are a little bit more prone to an impaction colic or a lipoma colic. And then lumps and bumps in general in our senior horses. So melanoma for the gray horses, sarcoids and squamous cell carcinomas. So the big three, that's an angry sarcoid. That's actually on donkey, but anyway. That would be a squamous cell carcinoma that is on the eye, and you can see it's a walleye or a blue eye on that horse. And then the melanomas that most of us are pretty familiar with. Not that those can't all be treated, but it's just really important to, to keep an eye out for them and take care of any lumps or bumps that come up. Dental care. This is a really, really, really big one in the senior horses. They do require more frequent dental checks. I usually recommend they're checked at least every 6 months. You may not float their teeth every 6 months, but check them at least every 6 months. Imbalances occur really quickly and they need to be addressed so there's no loss of nutrition, because older horses are not as efficient with their food and it's harder for them to maintain condition. And I think a lot of us inherently know as well that we may need to alter the diet of our senior horses in order to help with digestion. Sorry, flipping pages. There we go. Okay, so you can see on the right of your screen here is a horse that's doing a dental float here. This is a regular horse mouth. There's all of the teeth are present. It's pretty even. There's some ridges that need to be addressed, but there's nothing going on. On the left of our screen here, this is an older horse, and you can see there's a lot of loss of the tooth. There's not very much for this horse to chew with, and that horse is not going to be efficient in chewing his food or being able to digest his food. Something called wave mouth. Again, you can see here that this first tooth on the right-hand side, the first tooth is long and then the other teeth are short. On the left-hand side, you can see there's almost a hole there. And then the bottom teeth on the left-hand side are very, very worn down. So that's an older horse as well. But you can imagine that those grinding surfaces are not efficient at all. In the picture on the right-hand side as well, you can see the cheek is quite pink, and then there's ulcerated areas as well in that cheek. And so that's not going to be a horse that's going to be awfully comfortable having a bit in its mouth and been ridden. Okay, the next one. I'm not sure how many people are familiar with this disease, but if you learn nothing from me today, learn that this is a disease of older horses. Equine odontoclastic tooth resorption and hypercementosis, which nobody ever says. Most of us call it EROF. And it's a syndrome in older horses that causes resorptive lesions of the incisors, usually, sometimes the other teeth. And this is specifically a condition of older horses, usually 15 plus. It's incredibly painful. And so these are teeth. This photo was given to me by a colleague, actually. And you can see that the roots are all, this was under, the pink parts have a little bit of tissue still attached from the gum. And the teeth have literally dissolved. They become very, very, very painful, very loose. And these horses are often extremely reluctant to eat. And it's incredibly painful for the bit to be in those horses' mouths. It's actually shockingly common. And this is where I will say, please have a veterinarian check your horse's teeth, because this is a very, very, very common disease. I think you know, it's one of those diseases that gets missed quite a lot. And you can imagine if it's affecting the incisors of the horse, that the horse trying to reach down and pick grass or try and eat his senior grain with incredibly painful teeth. It's when we're already battling, you know, nutrition is tougher in seniors. This is a real big one, guys. So please keep a lookout to this. What we do is we actually remove the incisors, which sounds horrific, but these horses do so much better without those painful teeth. And they actually do really well. And horses tend to bounce back after the extraction of the teeth, which you wouldn't think, because inherently, you know, that doesn't make a lot of sense. But once we take away the painful teeth, they do quite well. The horse on the top here, these teeth have kind of resorbed, and these nubs in the top here are those teeth that had to be removed, and the bottom teeth actually had to come out as well. This is another really big one, metabolic disease. So generally speaking, there's two very, very common and separate metabolic diseases. There's equine metabolic syndrome, and there's pars pituitary intermediate dysfunction, or Cushing's disease. We used to call it Cushing's disease. We've now renamed it. So they are two separate diseases, but they often occur together. Horses with equine metabolic syndrome are more likely to develop the PPID syndrome. So this horse in the middle has both. So we can see the equine metabolic syndrome is the kind of the cresty neck, the fat pads on the rump. And then the PPID horse is the classic Cushing's horse with the long hair and the muscle wasting. And then our poor friend in the middle has both. Okay, we'll start with PPID. I do want to make a point for those of you that maybe haven't seen this rule change, that now Equine Canada and the US Equestrian Federation are now allowing you to compete on pergolide, which is the medicine that we use to treat PPID. If you're going down to the States to compete, you do need to have a once yearly testing, provide documentation from your veterinarian, but that is a change. You did not used to be able to be allowed to do that. I believe it's still on the prohibited list for FEI at the moment. There is a lot of work to try and change that. PPID, and this to me is a big statistic for us to take care of as horse owners. 15 to 30% of horses over 15 years. So a lot of our event horses are over 15. 30%, 1/3 of those horses likely have early PPID that we can and should be looking for and treating. Early signs and testing are really important. So the early signs can be really, really subtle. And it's really important that you speak with your veterinarian. If you're absolutely concerned, we get blood tests to diagnose it. The big one for us in eventing, we're going to go through this in a little more depth, is the associated clinical signs with PPID. I touched on it a little bit earlier, is that we get decreased tendon and ligament strength. And the big one that we see in eventing is we see the suspensory breakdowns with horses with PPID. There is a treatment for it. Pergolide is the drug name, and Presend is the trade name. And we now can show on that medication, which is huge because many horses do really well when we treat this. So this is pretty classic for the curly hair and the long hair coat. This is a pretty advanced stage of the disease, and it's pretty easy to spot. This is much more subtle, a weak top line. So we look at this horse and, you know, it looks okay. But then when you look closely, if you look at the horse's rump down to his tail, his gluteal musculature is not great. His loin musculature is not too great. And, you know, that can be the beginning of a weak top line. I'm not saying that every horse that looks like this has Cushing's for sure, because maybe he's just not been in training, or maybe, you know, but I raise it as a point to pay attention to, that if this is new for your horse and he doesn't usually look like this, speak with your veterinarian. Immune suppression. So this is a really big one again. The PPID can really affect your horse's immune system. So you can see in the middle there is kind of a skin condition or a rain rot that's taken over. There's, you know, bone infections, tooth infections, sinus infections, those types of things. So just knowing that if they are diagnosed, that their immune system can also be compromised. Tendon and ligament issues. So this is the horse on the right there has the kind of classic old broodmare broken down suspensories. And that's kind of a real one that we need to look for. And the horse in the middle, you can see again, those fetlocks in the back are almost touching the ground. And then the paw horse on the left there has a big old bowed tendon. It's just really important. Again, I want to bring your attention back to 1/3 of our horses over 15 years of age have, you know, likely have some form, even if it's mild, of PPID. And those horses we need to, I think, pay attention to. And if we have any suspicions, test them, because those are the horses that if we continue to have them compete at a high level, they are going to cause themselves harm. This is also a corneal ulcer from sort of immune suppression from PPID. So again, if you notice your horse blinking or squinting more or anything like that, again, you need to speak with your veterinarian and potentially have your horse evaluated or tested as a cause for that. Another one for us for eventing is sweating changes from PPID, because it is a hormonal or an endocrine issue. Most of us know our horses pretty well. We know if our horses sweat a lot, if they don't sweat a lot. And again, if you see changes in sweat patterns or funny sweat patterns, that can be a subtle clue as well that, you know, this horse may be starting to become clinical for PPID. That's a very whistle-stop tour. This disease can do a lot of things and present as a lot of different ways. Obviously, the horse up top there is very, very painful in his feet. Laminitis we know about. It can cause behavioral changes. It can cause urination issues. It can cause reproductive issues for our broodmares. I know that's not what we're discussing today, but I just want to bring that up as something to think about, because like I say, if this is something that's affecting 1/3 of our horses, I think we need to pay attention to it. Parasite management is a big one for older horses. They tend to be not as resistant to parasites as they age. And so you should be doing fecal egg counts in your aging horses. Again, PPID, parasite increased loads and increased burdens can be associated with PPID because of that immune suppression. And so the point of this slide is we do need to pay attention to our parasite management, and it may need to be a little different in our senior horses than it is in the rest of our herd. So the best way to deal with that is once yearly at least do your fecal egg count with your veterinarian. It's not a very expensive test to do, and then treat appropriately. There's some evidence out there and some research out there to say that our senior horses do require and do much better with increased parasite management. The other one that we need to speak about is insulin resistance, or equine metabolic syndrome. This is the one that we associate more with the laminitis, so the classic kind of fat pony on pasture that founders. Obviously, that's kind of the extreme case. Again, we're talking a little bit in our event horses. Sometimes they can be what's called subclinical, so they're not overtly lame, but their feet get sore. So we need to monitor that, and management is critical. This is a disease where we manage the sugars, and so those horses can't be on grass. We maybe need to soak the hay. Again, that's a very long discussion, but it's something that we need to be aware of. We can test for the insulin resistance with a blood test, and we do manage it with nutrition. And I haven't really touched on nutrition this evening because for the senior horse, nutrition is a huge issue. So I want everybody to be aware that there is different nutrition for senior horses, and for sure insulin resistance and metabolic syndrome can be a case for that. But what I want people to remember really is that insulin resistance and equine metabolic syndrome is very, very common, but that's more of a management, and we can manage these horses and they do really quite well. Okay, joint care, here's the can of worms. So when we talk about joint care, a lot of us think about or jump to joint injections. You know, we need to stop thinking about joint injections as maintenance or maintenance injections. It is a medical treatment. And every time that you go into a joint and inject a joint with steroids, you are affecting the cartilage of that joint. And so I think it's one of those things that there's a lot that we can do before we're into those joints. And there are also other things to use other than steroids. Now, some horses do great with the steroids, and that's fine. But what I come back to is those performance evaluations that we're going to do, you know, once a year or twice a year with your veterinarian, where you're going through and you're flexing and you're deciding what is appropriate for your horse. Not just willy-nilly injecting joints, because that's actually not the best way to get the longest life out of your horse. Targeted treatment is. Steroids are the classic thing that we inject into joints. And then now we have a whole plethora of regenerative medicine. So IRAP, PRP, stem cells, ProStride. There's lots and lots and lots of options. So that's really one for you to discuss with your veterinarian and decide what may or may not be appropriate for your horse. Different horses definitely respond differently to different treatments. But my main point here is that joint care does not equal joint injections. It means we're going to care for the joints. Legend and Adequan. Make sure if you're using them that you're using them correctly. Adequan should be administered 1 every 4 days for 7 treatments, which I don't think most people do, if I'm honest. That's been shown to be the most effective way to use Adequan. Legend, we're still in the, you know, you can do loading dose once a week for 3 weeks, and then a lot of people will do a monthly maintenance dose as well. Definitely speak with your veterinarian again with what they would recommend for your horse, but Adequan and Legend are fantastic in our senior horses, and I think pretty underutilized, honestly. You know, I think we can really be much more positive about using them to help our older horses. Supplements, always a good thing. So things like a glucosamine, things like an MSM. I will say caution with the MSM now. Magnesium under FEI is now in the, I believe, prohibited substance. So we can't have the horses on MSM. But, you know, with our event horses, that's, if we're under Equine Canada rules, we have to be very, very careful with supplements. Having said that, glucosamine should be fine, collagen should be fine, all of those things. I list supplements there because honestly, there are so many and they're so specific that it's a conversation to have either with your nutritionist or with your veterinarian about, again, what is appropriate and correct for your horse. Really, joints need to keep moving. So motion is lotion. That's the one to remember. Movement is essential to joint health. So when we have a joint, just like your car, we don't at -40 go out, start our car and drive right away because the oil is thick. It's the same with synovial fluid in the joints. It takes time for that fluid to warm up and have its protective capabilities within the joint. So older horses certainly may require a longer and a slower warm up in order to get that synovial fluid to flow and work properly and appropriately. So think about it like oil in your car. And if it's a little cooler and you may be going first thing in the morning, your horse might take longer to warm up. And that's okay. You just need to plan for that. And generally speaking, older horses do take a little bit longer to warm up. The synovial fluid isn't quite as free. It's not quite as effective. So we need to give those joints longer time to warm up, and also longer time with lower stress. So lots of walking for warm up. The other thing, and this may or may not be feasible for every horse, but turn out, turn out, turn out. If we keep them moving and we keep them walking, they do significantly better than if they're standing in a stall for 23.5 hours a day, which may be the reality for some horses, and that's fine. But with the senior horses, movement is much more important. It's important for every horse, but for the senior horses, we just need to pay particular care. Chiropractic evaluation, chiropractic care is safe as long as it's performed by a correctly trained individual. There is specialized training, and you should be looking for somebody that bases it on functional neurology. It's also an assessment of joint health and joint motion. So that's always a good one to have regularly assessed by part of your equine wellness team, along with the veterinarian examination and performance evaluation. Exercise considerations. So this is me hosing my horse's leg at, I don't know, 11 o'clock at night, because that was when I was home from work. We've all been there. So it's better to remain, whoops, that's a typo, sorry, remain in consistent work. So with our older horses, it's a little bit more important to keep them in some low level of work all year than to give them time off and then bring them back into work again. It is much harder to build muscle and condition in older horses. So for their joints and for their condition, it is more important that they remain in consistent work. Warm up and cool down should be considerate. So like I was saying before, they may need more time, both in warm up and in cool down. Their systems just aren't as efficient anymore. And as long as your older horse doesn't have a condition that prevents him from being formally exercised, it's much better to keep them in some work. In human studies, for sure, regular exercise can largely prevent and even reverse the muscle loss that goes along with aging. Exercise also maintains bone density, improves the health of the joint cartilage, and minimizes stiffness. So these horses really should remain in some level of work if possible. Maybe they have an injury or some other condition that means they're not suitable. But even if we need to look at downgrading, or it's time for the horse to do a different job, that may be appropriate, but we do need to keep them moving. And this is where I'll encourage people to get creative, right? If your horse has a condition that maybe his saddle hurts him, maybe that horse can go be driven somewhere. You just have to get a little creative. And you can always hand walk them. They don't have to be ridden, but if you can keep them moving, that's great. Okay, this is a really big, fancy, long word. immunosenescence. So it's a process of immune dysfunction that occurs with age and includes remodeling of the lymphoid organs, leading to changes in the immune function of the elderly, which is closely related to the development of infections, autoimmune diseases, and malignant tumors. So the reason I bring this up is we really need to pay attention to how we vaccinate and care for our older horses, because their vaccine response is different. And so if we're going to remain eventing and taking our horses to competitions, we need to remain vigilant and aware that those horses, even if they're vaccinated, may not be as well protected as younger horses that are in the prime of their career. I'm sure everybody by now is aware of the incident in California and the terrible things that happened to the horses down there. Nobody's fault, but you know, vaccines are not infallible. And I think it's just really an important point to remember that with our horses, as they age, their response isn't as good to vaccines. So you may speak with your veterinarian. It may be appropriate if you're competing your horses or taking them to competitions with, you know, at our events, they have nose to nose with the horse next door. They may require a different vaccination schedule. So that's a discussion for you and your veterinarian. On the flip side, sometimes as horses get older, they actually develop vaccine reactions and they're not able to be vaccinated. And vaccine reactions are more common in older horses. So again, it's very much an individualized program and a discussion to have with your veterinarian. It's very much a risk-benefit analysis because we do have contact, we do have nose to nose. It is a risk going to a competition and we want to protect those horses absolutely by vaccinating them. But at the same time, we want to make sure that we're not inciting immune reactions or having them you know, come to any harm because we decided to vaccinate them. So that was a bit of a wild ride. We'll just kind of check back over a few things here. And so really caring for your senior horse is support the immune system. So we've kind of talked a little bit about that, minimize the risks, manage the diet. And that really is dependent on if we are managing any metabolic issues, if we're managing no teeth. And that's really where a nutritionist can be incredibly helpful when we talk about the diets of senior horses. We need to manage the parasites. We know that they may be more susceptible. We need to watch out for lumps and bumps. They may be nothing, they may be something. We need to keep the joints healthy. By moving. Gentle movement is always good. We do need to check for metabolic diseases, and it's really important to talk with your veterinarian about the timings of tests, because specifically for PPID, there are times of year that we can get accurate results and times of the year that we can get inaccurate results. Complete dental exam. Please, 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 if you do nothing else for your senior horse, get a dental exam at least twice a year. Routine blood work is super helpful for us to flag any issues that are coming up. And then obviously keep him moving. And maybe that behavioral ethogram of the ridden horse is helpful in helping you assess whether your horse may need to step down. And I think sometimes that's a really hard discussion for people because sometimes the horses are ready to step down before the people are ready. Oh, now it's not working. So remember, we do this for fun, everybody. This is my favorite picture that Jessica took. And we can kind of look at the chat. I'll stop sharing my screen and then we can look at the chat. I think, Jessica, does that sound like a plan?
That does sound like a plan.
All right, do we have questions?
Nobody has typed anything yet.
No questions?
Not yet, but there'll probably be some that sort of pop up and get rolling. I have a question.
Yeah.
For an older horse, I know lots of people like to give them like a month off for the winter off. It sounds like that's not something you would recommend for an older horse.
So it's actually not, and it's really counterintuitive. You're exactly right, because we feel like we're being kind and, oh, we'll give them a rest, but it's harder. Every year we do that, it's harder to bring back and condition them. So what their research is showing is now that it's better to keep them in a low level of work. So absolutely decrease the intensity, but keep them in some form of a program.
That makes sense. Even if it's just like hacking a couple times a week or something, right?
Yeah, just
benefit.
Keeping them moving, because the younger horses we can, we talked a while ago when we were talking about fitness and tapering up and tapering down of fitness in horses. For sure, we need to taper down the horses appropriately, but keeping those older horses moving is so much better for their joints. Okay.
Awesome. All right, we have some.
I can see them. Okay, so how do we test for PPID? PPID is a blood test, and the times of year, so we don't want to test for it in the fall, because in the fall there is a natural spike in the hormone, the ACTH hormone, that we test for. And in normal horses that are not clinical, there is at least a double-fold increase, sometimes triple, sometimes even more than that. And so we know that when we test in the fall, it's not accurate. And so we should be testing, and you can speak with your veterinarian, and actually Boehringer Ingelheim, which is the drug company that makes the Pedersen medication, often runs promotions with clinics where if you test your horse and your horse is positive and you end up using their product, they'll pay for your blood test. So speak with your veterinarian, but it's a simple blood test, but the timing is really important. Yeah, and I think it was Erica that mentioned here, when is it a good time to test? And she said some points you mentioned, rang a couple of bells for my gelding over the past year. That's exactly what I want people to pay attention to. So thank you for that note. If you're seeing one or two things and you're like, maybe you test this year and you get a level, and then maybe you test next year and the level is increasing, and then you can sort of look at whether that needs medicating or not, but it's something to watch for sure. And we know that they're prone to those soft tissue injuries. So I think it's really important that if you are at all suspicious, get the answer before you start to up the workload or anything. Are there any treats that should be avoided in older horses? My answer to that would be if they're difficult to chew. We know that older horses are more prone to choke because their teeth aren't as efficient at chewing the food and breaking it down. And so really it would just be anything that they couldn't chew. And other than that, I wouldn't say there's necessarily anything that could be avoided in terms of the content of the treat. To me, it would be more how it was put together and whether it was easily chewable.
Would there be any consideration of, like, say if a horse had PPID or insulin resistance, about like not giving them high sugar treats?
Yeah, so I think it really depends on how sensitive the horse is as well, because there are some horses that if they have equine metabolic syndrome and you give them a carrot, that can have enough sugar in it to put them over, and some horses are not as sensitive. So that's a super case by case basis, but for sure if you have a horse with insulin resistance, you do need to be careful what you choose for a treat. Thank you, good point. When is the best time of year to do a fecal egg count? So most people like to deworm after the first hard frost, because we know that any parasites that are in the ground then after the first hard frost are not really they're not really viable anymore. So then if you do your fecal egg count, you know what everybody is carrying, and hopefully you address that internal parasite burden, and then nothing is shed into the ground that the horses are going to eat again. So for me, that's a good time. Traditionally, we kind of deworm, fall and spring, but really I think a fecal egg count after the summer season of being on pasture gives you a real honest assessment of the burden in your pasture. Can I speak more about Equine and Legend and why I recommend them? The problem I have found with Legend are the constant vet appointments required because of the injection into the vein. That's a fair point. So They work in two different ways. So Legend is hyaluronic acid, and Adequan is something called PS-GAG, which is polysulfated glycosaminoglycan, which is not really important, other than they're two different medications, and they work differently. You're right. The problem with the intravenous is that a lot of people struggle to give it. My personal feeling is I find the older horses typically do better on the Legend. That's sort of been my experience. But you're absolutely right. If you're not comfortable giving an IV injection or your horse isn't great, then you're right, it does become impractical. I'm quite happy with my clients to teach them to give IV injections of Legend. I've had a lot of success with that. So that might just be a conversation with your veterinarian, but a lot of people aren't comfortable, and that I respect that. It's not a nice feeling if you're not comfortable doing it. And so the Adequan is in the muscle. The problem that we've had lately in Canada is the supply chain of Adequan hasn't been fantastic. In my experience, in most equine vets that you talk to, most of us feel that horses do better on the Legend. However, horses that don't seem to respond to Legend seem to do better on the Adequan. And so I think for me, it's a little bit of a personal, the horse's personal preference, if you like. And there's absolutely nothing wrong with doing both. Right? You don't have to pick one or the other, but I think it's one of those things that if you are going to give it, then just make sure that you give it appropriately and properly, because otherwise you're just wasting, your time and your money, which nobody wants to do.
I have a question about the Legend and Equine. I know some people say there is like not the brand name, just the generic ones. Do those work just as well?
So again, it's anecdotal. So the generic ones are not technically labeled, so we have no efficacy studies. Where we have to be really careful, in the US, the compounding pharmacies are not nearly as tightly regulated as they are in Canada. So the big one that came out was the omeprazole study for GastroGuard, and the generic GastroGuards in the States were like 10% as effective, because the pharmacies down there are not as tightly regulated. We're quite lucky in Canada in that our compounding pharmacies are more tightly regulated, but the problem is that the carrier compounds that they're in and the stability of those sort of compounded medications or generic medications, we just don't have the data for. So that's a conversation for you and your veterinarian to decide if you're willing to take that risk or not. And some people report good findings, but we just don't have the data to back it up. So it's not a recommendation we can make. Having said that, I know a lot of people choose to do it. So that's kind of a buyer beware, or a kind of you make your own choice on, if that makes sense.
Wow, that's really, really interesting, actually.
Okay, I lost where I'm at in my thread here. How would you go about conditioning programs? So rest and recovery, conditioning during shows, work, jumping versus conditioning. Katie, I'm not really sure. Are you talking specifically or for older horses? Maybe just pop your microphone on and ask me your question, Katie.
Hi there, Sarah.
Hey.
I'm just wondering what your program would be for conditioning an older horse and what that may look like for jumping. Is no jumping better if you can do it, or?
Oh, okay. Yeah. Sorry. Okay, I understand. I think for me, it would be important to take it maybe a little bit slower than you would take it. So say our traditional kind of 12 to 16 week conditioning program for our young horses, we might need to be, 16 to 20 to 24 weeks for an older horse, just because we really want to protect that soft tissue. I don't think that saying no jumping is, I don't think you can make that blanket statement. I think it's just about really making sure that the warm up and the warm down is done really, really carefully. But you know, there's lots of 15-year-old horses still jumping and still sound and doing the job. So I think, you know, for me, jumping in and of itself is fine. That might be where with an older horse that's maybe 15 or 16 and we go to a competition and our ground isn't great, you might think about scratching your older horse a little sooner than you would think about scratching your younger horse, just again because of those soft tissue components. But in terms of, you know, their work versus jumping or no jumping or whatever, I think you still need to condition those horses. We still need to have the bones being conditioned. We still need to, you know, have those horses be strong. The other thing to remember that generally, you know, the older horses generally don't need to be schooled as much, because really at 15 or 16, we hope that they should know their job. So we can maybe be a little bit more thoughtful and careful about how we choose to school those horses. Maybe they don't need to go to every, you know, schooling day or cross country day, and maybe we can be a little more cautious with them that way. Does that make sense?
Yeah, totally. Thank you very much.
You're welcome. Is Pedersen equal to Legend in its effectiveness? We don't know. Nobody's done the trial yet. Some people really like it. Some people say it's not as good, but there's not been a head-to-head yet, which I think somebody will have to do at some point. Sorry, that's not a very good answer to your question, Shannon. Alyssa, ulcers, what is the best treatment? Okay, that's a big topic and a big can of worms. I feel like ulcers get blamed for a lot of things, and there's very, very few people actually scoping the horses and looking for the ulcers. They just tend to treat them. So my answer to your question is scope the horse and make sure that the horse actually has ulcers. Because then, you know, if you know which type of ulcers the horse has, you can tailor your treatment. So there's been a lot of research lately looking at stomach ulcers, you know, stomach ulcers in the front part of the stomach versus stomach ulcers in the back part of the stomach versus hindgut ulceration or hindgut inflammation. And if you have the horse scoped, then you can tailor your treatment, because we know that the gastrogard is much, 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 much better at treating ulcers in the front part of the stomach. Ulcers in the pylorix part or the back part of the stomach tend to respond to different medications, sometimes misoprostol, sometimes we can treat with gastrogard as well. It just depends. So my answer to that question is we have to tailor the treatment for the type of ulceration that we see, and the only way to know that is have the horse be scoped. Does that answer your question, Alyssa? You can throw your microphone on and say yes or no.
Just a little slow, but
Oh, there we go.
Yeah, can you hear me?
Yeah.
Yeah, so you're just saying best recommendation is scope the horse.
Yeah,
and
because
then accordingly to where they find
correct.
ulcers, you're customizing a treatment.
That's right. And so we know that with the squamous ulceration, that 30 days of gastrogard will improve in 90% of horses, will improve the ulcer grade by 1 full grade if they're the squamous ulcers. If they're in the back of the stomach, sometimes we'll tailor the treatment a little bit differently. And I think this is where ulcers, A, are really difficult to treat, but B, kind of get a bad rap, because I think a lot of people just throw their horses on omeprazole or gastrogard and then, it didn't do anything. Well, maybe you weren't treating the right thing, right? And so I think it's one of those that honestly, the best treatment is the one that is correct for the type of ulceration that your horse has.
Yeah, okay. Well, thank you.
No problem. Would you use Legend over high 50 in seniors? So a lot of people, there's a lot more people that would like, you know, that are liking the high 50 to use. I think it's one of those that we just have so much more information on the Legend versus the high 50. There's just less studies. And it's not that it's any better or any worse, we just have way less information on it. And so my answer to that would be, I would say use what, you know, you and your veterinarian feel is appropriate for your horse. And some people are going to see better results with one than the other. And I would say that at the moment is a very personal and a very individual decision. MSM glucosamine, can you overdose? Absolutely. Just because they're supplements doesn't mean you can't overdose. So like everything in medicine, there is a toxicity level for those. You'd have to try really, 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 really hard, but yes, you could. MSM, especially if there's other metabolic things going on with the horse, the magnesium can get a bit funky with that. And so you do need to, you know, either pay attention to dosing guidelines or speak with your veterinarian if your horse is on any other medications, make sure there isn't any drug interactions. That's definitely something to consider. Regarding keeping our seniors moving through the winter, how cold is too cold for work? That's a really good question. So we also at that point need to consider lungs and whether there's going to be damage to lungs. And so I think most people are pretty comfortable kind of -10. They'll, you know, you don't need to do a hard work. I think most people don't ride generally at -40. So I think it's one of those that, is there a cold wind? Is there, you know, do you have an indoor arena? Is there heat in that indoor arena? Because the other thing is, if it's, you know, -30 outside and we bring the horses in, they have to warm up, but then when we put them back outside again, that can be quite a shock to their system as well. So it's not necessarily just, is it too cold for work? It's also, you know, are they going to adapt okay to going back outside? All of those things. So I think it's one of those that it depends on what the weather's going to be like overnight. It depends on if you have time to dry your horse off appropriately. And I think that, you know, we need to also pay attention to how long that horse is walking for and how long that horse is warming up for and how long that horse is cooling down for as well. So I don't think there's a hard and fast rule, but I think, you know, we need to pay attention to, you know, yourself, if you walk outside and it's really cold and you take a breath, it hurts your lungs, that would be too cold for work. That would be my kind of sort of guide, I suppose. Ulrika, you mentioned that melanoma is treatable. What else can you do for it? So surgical excision, we can take them out. And also there is a vaccine now that is underway for melanoma. So that's pretty exciting as well. So that there's a few things that we can do for it. But really, generally speaking, if they're causing problems, we take them out. Okay. Equine as such have been brought up so frequently. What do you typically quote clients for efficacy of either IV injections such as or supplements such as glucosamine? So Alana, the problem with talking about efficacy of supplements is that this is a really difficult conversation, because the supplements in Canada, it's actually voluntary. And Tanya, if you're on here, I can't see your name, but if you're on here, feel free to jump on and speak with me here. There's no regulation for the supplements, or if there is regulation, it is very much voluntary. And so it's really difficult to talk about the efficacy of a supplement because everyone is different. And then alongside that, we don't have any studies comparing those specific brands. And there's so many supplements out there. You know, you walk in and you look at, you know, shelf upon shelf upon shelf, and you don't know if they've tested. And there's actually no law in Canada, which is a little bit scary. They can put whatever they want on the label, but actually nobody's holding them accountable to what's inside. And so I think that's a really good, but a really really difficult question in terms of, do I think one is better than the other? I think absolutely, if we're giving the horse the medication in its vein or in its muscle, I know that that horse is getting what I'm giving it. Having said that, there's some excellent supplements out there and there's some not so excellent supplements out there. And so I think that's very much a buyer beware, and do your homework in terms of, if you're going to choose a supplement, is it from a company that is voluntarily testing? Where do they source their ingredients from? Those types of questions. Best leg care after cross-country jumping. Some studies show that glucosamine isn't always absorbed or metabolized by horses properly. Yeah, so that's exactly, so I'll answer the second part of your question first, Katie. The absorption of the glucosamine, absolutely, it depends on where it's sourced from, how we're getting it, what else is in the supplement. So it's so dependent on the supplement that you're using and the bioavailability of it. A lot of people are looking at collagen as well. And so, glucosamine isn't the be all and end all. It certainly is helpful. MSM is helpful as well. But again, be careful with competition with MSM. And then we also know that omega-3s and nutrition is a huge topic, but omega-3s as well are very, very, very helpful in joint health and inflammation in general. A lot of people like turmeric, which again, there's lots of evidence to suggest that it's helpful. My understanding currently is, for us to dose horses appropriately, you have to give them way more than people are giving them. And so I think it's one of those that, it really is, if you find something that you feel is working for your horse, that's great, but it is incredibly difficult to give any veterinary advice on supplements other than the ones that have some studies behind them. And there are a few companies that have some independent studies behind them, but that's a really difficult question to answer, and a much longer and more complex explanation probably than I'm giving. Best leg care after cross country or jumping. Cool the legs, get the boots off. So we know that keeping those tendons heated up is what causes the injuries, generally speaking. And so if you've got boots on, rip the boots off right over the finish line, cool them down, and we need an ice slurry. So the ice boots that you get, standing your horse in a bucket of ice, is not going to do it good unless you've got water in that ice as well. We need a slurry of 4 degrees. So that is a slurry of ice and water for at least 15 minutes, and warming them down as well. And so I think, a lot of people jump off after cross country, rip the boots off and go on there, ice the legs. You also need to walk them. And so allowing the body to cool itself as well, and then icing the legs. Did that answer everybody's questions? I think so.
So, well, yeah, I don't see anything else.
Yeah. Wait, there's another question.
Go, Sandra.
Right, shoot.
Go, Sandra.
Maybe I'll just ask, if you don't mind, because by the time I type it out, you're all going to be
no problem.
So it's interesting that you bring up the boots, because that's something that I've heard a lot about, and I argue with my daughter about all the time. Is I feel like for just sort of everyday work, that it's probably not good to put boots on them, because you're heating them up probably needlessly, unless you're actually trying to protect them from harsh jumps and stuff. Would you mind talking a little bit more about
Sure,
whether people overuse them, all that kind of good stuff?
So there's a real trend right now, and I'm going to try and not be judgmental, but there is a very big trend right now to be matchy with your ear bonnet and your saddle pad and your glitter boots. That's great, but you're absolutely right. Heating the tendon up is not a good idea unless we're cooling it down, and the less that we do that is, a good thing. So I'm old enough that horses only used to wear boots when they needed protection. And so if you have a horse that interferes with himself, or you're doing, you're introducing a new exercise, or the horse might, step on itself, then absolutely protect those legs. If you're putting the boots on just because you're schooling and you would like to be matchy, that's probably not a great choice. And I'm probably going to get lynched by all of the companies that make all of the nice matchy products. Does that make sense, Sandra?
Absolutely. Thank you so much. I appreciate that.
No problem. Okay, when is it not recommended anymore for a mare to give birth? That's a good question. It really depends on the mare. So really what you're looking for is the muscle structure of that mare, her physical condition, her body condition score. And then also as they get older, their uterus does begin to degrade. So most people will do either a uterine biopsy or at least a reproductive ultrasound examination to make sure there aren't cysts and those types of things. And so it is an individualized, there isn't like a magical number there, but it is a discussion you need to have with your veterinarian, because as they get older, you know, if they're not maintaining their condition anymore, you don't want to put your mare at risk by having her give the nutrients to a foal and then feed the foal with milk and run her own body into reserves. And so that really is dependent on the mare and how she's doing and what type of, you know, did she carry last year? Has she overwintered well? All of those types of considerations. So that's really a kind of a personal to each mare question, but there are certainly things to discuss with your veterinarian about, you know, like I say, the state of the uterus, the body condition score of the mare, and those types of things. And also, I think brood mares kind of get the short end of the stick from a dental care perspective. I think a lot of people just think because they don't have a bit in their mouth, they may not need dental care. And as the broodmare ages, obviously they may struggle to be efficient with their food and their nutrition. And so that might be a consideration as well, as if she's not, you know, able to chew her food anymore, or she's not able to maintain condition because of dental issues, then that would certainly be something to consider as well. Katie, oh, no problem. Katie asked effectiveness of exercise wraps such as the escadron wraps. Katie, just pop your microphone on so that you can, so are we talking about just the elasticized wraps or you're talking about cooling wraps?
The elasticized ones. They're
Okay.
like, they're tighter than a polo wrap, like not a fleece wrap, but the exercise ones.
Okay, so when you say effectiveness of them, what do you, so this is a little bit of a trick question, so I'm not trying to catch you out, but when you say effectiveness, do you mean of preventing injury, or like what are you referring to when you say effectiveness?
They're supposed to be for support. I know a lot of people have used them quite often, especially in show jumping and for hacking. Would it be better to just not have that heat applied to the leg and just go without?
Okay, I understand the question. Yeah. So, so the effectiveness in terms of support, you are not holding 1,200 pounds of horse up with a piece of elastic. And so there is a real big myth out there, and it's a little bit of a pet peeve of mine that, you know, they support. What they help do is they do help move the lymph up the leg as they're walking. So it's a little bit like compression stockings that old ladies wear. And so they do help with moving the lymph up the leg. So if you have a horse that maybe stocks up a little bit and, you know, you're taking him out hacking and you'd like to move the lymph and get the swelling out of the leg, they do help, I think. If you're doing a real fast workout and you're concerned about the heat of the tendons, then absolutely you might want to look at something different. So I think it's just, you know, why are you using them? And if it's a horse, like we say, that is prone to stocking up a little bit and you're using it to help support the lymphatic system, then yes, but you're not going to support tendons with exercise wraps. It's just not what they do. And I think there's a real misunderstanding across every equestrian discipline that you can wrap a horse's leg for support. It doesn't support the tissues, the bones, or the structures. It supports the lymphatic system. Does that make sense?
Yes, it does. Thank you. And just one last thing. I'm wondering about lunging, because I know a lot of lunging in older horses. Should you just hand walk instead, or is it?
Yeah, I
detrimental at a
mean,
certain point?
so lunging obviously puts, they're on a constant circle. So you're putting that torque and that centripetal force on those joints. So I would say if you want to lunge your horse, I think it's really reasonable with our senior horses to maybe do 1 or 2 or 3 laps hand walking of the whole arena to give those joints time to warm up, to give those joints time for the synovial fluid to start moving, to get the heart rate up a little bit, to warm those muscles up a little bit. And then if you feel you want to lunge your horse in, a Chambon or whatever, the Pessoa or whatever you feel you need to use to work the horse, or if you just simply want the horse to trot and canter and, have a bit of a workout, that's fine. But I think with the older horses, especially, a lot of us are really bad about, if you're lunging your horse, you walk into the arena, the horse goes out on the circle and off it goes. And I think hand walking them for a few laps beforehand can be really beneficial just to warm those joints up.
Okay, thank you very much.
No problem.
I have a question, sort of similar to what Katie asked about the wraps and what you were saying about the lymph. If an older horse is starting to stock up a little bit more than normal, would it be like, I know there's like equi sleeves, there's like equi crowns, there's all sorts of boots and stuff for that. Would the use of those sort of things like regularly help, or would they make it worse if you're using them too much?
So my understanding with those types of products is they're really quite helpful in the short term, but the horses can kind of become reliant on them. Right. And so if you have a horse that does stock up and they're really blown up one day, yeah, for sure, put them on, take the horse for a walk, like let's support that lymph system. I've also used the wraps, I think the crown ones, the equi crown ones that have like the bra strap hook and eyes up the front. So those ones I've used really successfully in recurring cellulitis cases, and they've been really quite helpful in those cases. Specifically, I've had a lot of luck with the hawk ones in those because the hawks are really difficult to wrap well. So those I've had a lot of luck with, but we have always sort of weaned those horses off the use of them. If that, just like you would wean off a medication, we've kind of put them on for a shorter period each day as we've weaned those horses off them. So I think they do have a place for sure, especially maybe your horse has had a really hard school or whatever, and then for whatever reason it's going to be bad weather the next day, they're not getting turned out, something like that I think is really reasonable. But I think sort of, them wearing them every night for the rest of their life is probably not helpful in the long run, because at some point, if that doesn't work anymore, you're kind of out of luck.
That's very true. No, that makes total sense. Perfect. Thank you for that.
No problem.
Sandra has another.
So Sandra, that is, sorry, I should read the question. If you're just jumping small rails, are boots recommended, or is it fine not to wear them? So that's a little bit of a threefold answer. Number one, speak with your coach. Number two, it depends on your horse. My horse doesn't wear boots anyway when he show jumps, because bless him, he's not the most careful soul. And so he gets to feel the rails because that he needs that for him. And so I think that it's really individual for the horse. So like a small jump, I think it's fine to jump without them. But again, if your horse is one that tends to interfere with himself, or that he brushes when he comes around the corner into a fence or whatever, if there's a reason, put them on. If you just feel like you should wear boots for jumping, then I think it's fine to chat with your coach and go without. It really depends on what your coach is seeing on the ground as well, and how your horse moves. So again, it's a super individual conversation. I always ask people to kind of consider why they're using a boot. So if you're concerned that your horse is going to bang his legs, even, over a 2-foot rail, then absolutely put them on. If you're not concerned about your horse banging a rail and you think that there's no real indication for them to wear them, then absolutely. And I'll kind of ask you a little bit of a pokey question here that, if your horse is turned out, does your horse wear boots when it's turned out? Because really it's more likely to interfere with itself when it's running around the field being a lunatic than it is jumping a small rail, right? And so then we get into the whole, well, should we turn out with boots on? Should we, right? It's a whole, so I think that's just something that you need to kind of come to and be comfortable with yourself and just have a reason for doing it. So my horse doesn't wear boots when he jumps. Like I say, that's a personal decision for me. He absolutely wears them cross country because for me, like I say, he's not awfully careful and he'll probably bang his legs on the solid jumps. And so that's a very conscious decision that I'm making, that in the show jumping, he doesn't wear them. And in the cross country, he does. And schooling cross country, he still wears them. And schooling show jumping, he doesn't. And that's what works for me. And for me, that feels right and it's justifiable. Whereas, you know, for other people, they might always jump their horse in boots because, you know, their horse might bang its legs. So it's a super personal discussion. Chat with your coach. Ask your coach what they're seeing from the ground. If your horse has worn boots in the past and the strike plates are all scarred up and the horse is obviously interfering, then it might be a much more sensible thing to wear them. And whether your horse wears shoes as well, that's kind of another decision. So there's lots of factors that go into deciding. Regarding the vaccine reactions, does it come to a point where the vaccine reaction outweighs the vaccine protection? Yes, it does. I have a coming 17-year-old who reacts to most intramuscular injections and especially his vaccines, tried splitting the vaccines, going, yeah, and going to the butte the day before, day off, all the rest of it. Instead of the neck. My personal opinion is right now would be to stop vaccinating when he eventually retires. Is that the most responsible solution? Okay, so what I would recommend is speaking with your veterinarian about titer testing, because if your horse has an acceptable level of titers, then you don't need to be vaccinating anyway. Your horse is protected. Now, word of warning against that, we don't have a lot of research to suggest what actually is a protective level of titer. So that's a real can of worms, hot button topic in veterinary medicine right now, but it's absolutely an important conversation to have, that if the risk of giving the vaccine is outweighing the benefit of having the vaccine, then medically that's not the right choice. And that's why I was saying kind of in the vaccine thing, that it's a super personal decision and it really is individual on the horse. So do I think that's responsible? Absolutely, I do, because at some point, the risk of an anaphylactic reaction is too much. And, you know, so with that particular horse, it might be a case of it's actually in that horse's best interest not to give the vaccine. But that's where it's really important that the horses around that horse, especially if they're going to competition, are vaccinated and protected, so hopefully they don't bring anything home. So it's a little bit of a lifestyle management, and it's a little bit of a conversation with your veterinarian as well. And this is why it's so difficult to give a one size fits all, because medicine is still individual, and what's right for your horse might not be right for my horse. But I don't think that's irresponsible. I think that's absolutely responsible. It sounds like you've been working with, you know, your veterinarian, talking to the representative. So, you know, we're not talking about a little bit of a sore neck, we're talking about an actual reaction. And I think that's, oh, Callie, oh, well done. You're reading my mind. Am I talking about serious reactions or swelling and tenderness? So redness, swelling, tenderness are considered side effects of a vaccine. They're not considered a vaccine reaction. Okay. And I think especially given the last 2 years of all of our lives, people are very, very, very gun shy about vaccine reaction versus a vaccine side effect. And so to me, what we're describing here in a horse that, you know, is having real serious reactions to a vaccine is absolutely, you know, we question that. If your horse is a little bit stiff and sore for a couple of days, that's not a vaccine reaction. That's just a response to the vaccine. So that's it's just considered a side effect. And what I tell people about that is, like, have you ever read the inserts on Tylenol or an Advil? Don't do that because you'll scare yourself. But it's a little bit like that all medications can have side effects, not always serious, but all medications can have side effects. If your horse is a little bit stiff for a day or two, then it's worth vaccinating that horse, because now we're protecting that horse. If your horse is getting sick and a fever and can't eat and isn't drinking and it's getting a colic because it won't reach its neck down, that's a vaccine reaction. Does that make sense? Hopefully.
Hopefully.
Yeah, sorry. Yes, for me it makes sense. He's one of those that get a fever, all 4 feet are
Yes.
planted and barely moving and everything like that. But it was
Yeah,
good for Carly to clear up.
So for me, that's a case where, yeah, I think it's one of those where, risking that horse being unvaccinated is probably a smaller risk than risking that horse being vaccinated.
Okay,
right?
thank you for that.
Yeah, and it's just, that's a conversation to have with your veterinarian. And like I say, the lifestyle and the management of that horse as well, and ensuring that he has herd immunity, ensuring that new horses that are brought in are potentially isolated for a few days away from that horse. You can do other lifestyle things to manage that. So do chat with your vet about that.
Absolutely, I will. Thank you so much.
No problem.
Perfect. So we'll just give everybody another minute or two. If anybody asks or has any other questions, you can type it in the chat or pop on. I'll just quickly thank Kathleen Ziegler for arranging this Zoom session, and Dr. Sarah for her awesome, very informative presentation. Always so many other little things pop up and all those questions. It's great. It really makes your brain work. That's perfect.
I know, it makes mine work too. It's hard.
No, and I'd like to thank the HTA for sponsoring this. I already see that we have some tags on Instagram, so thank you, Katie, for that. I was also going to mention, so Dr. Sarah has done a couple other webinars for us the past couple of years, and those are all on our YouTube, in addition to our 2 previous ones we did with April Clay. So everybody that attended or registered, I'll be sending out thank you email, and I'll include the study that Dr. Sarah had mentioned earlier, and then I'll also include a link to the YouTube, a recording of this, and then if there's some other ones that interest you, you guys can watch those too.
I'll post this, but the ethogram for the trainers is a really good one. So I'll make sure that you have access to both of those, Jessica.
That would be perfect. Yeah, just shoot them to me in an email, and then once I get this uploaded, which will be in a couple of days, I'll send it all out. It looks like Marie has a question. Any tricks for the winter to avoid ice forming on the tail of horses?
Well, the big kind of ice dreadlocks that you're talking about, the only thing that I have been told is you can use Vaseline to stop it forming, but that's awful messy. I'm totally willing to take advice from anybody else on this one. You can put Vaseline in their feet as well to stop them getting the snow stilts. That actually works quite well. The snowballs pop out, but it does get really messy. There you go, baby oil. That might be better.
Or a tail bag. Perfect. All right. Okay, so I think we're about ready. Oh no. Oh yeah. Oh, you see that one, Sarah?
I have a man with diarrhea and menstrual blood and urine. Oh, yeah. So I would say in that case, then probably tail bag. Yeah, I would bag that up and tie the tail bag up. That would be a good choice for that one. So if you braid the tail and then put the rest of the tail in the bag and then tie the bag up to the braid so it tries to keep it out, that's probably the best for that type of situation. No problem.
Perfect. All right. Okay, I think we're good to wrap it up. Thanks everybody
Sure.
for coming. Thank you, Sarah.
No problem.
And hopefully we'll see you soon out and about this nice warm weather.
I
longer
hope
days,
so.
And see all
Yes.
you awesome people out doing fun eventing things.
All right. Thank you so much, Jessica. I'll
Right.
make sure and send those to you over email just in a little bit here. Okay.
Perfect. That sounds great. Thanks so much. All right.
No problem. Have
Thank
a good
you,
evening, everybody.
Bye.